and welcome to the Wound Care Clinic. We're here for the workbench segment, and we're going to be looking at some exciting negative pressure wound care technology. I'm very pleased to be joined today by Beth Bradley. Beth is the Director of Clinical Affairs for ITI. Hello, Beth.
Hi,
how are
there.
you doing?
Thank you so much for having me.
Oh, thanks for joining us. And we're joined by our patient, Christina Brown. Christina had a mishap with a surgical wound, and we had a large wound to deal with. And a couple weeks ago, we put you on the Quantum from ITI, the negative pressure device.
Yes.
How has it been working for you?
I love it.
You love it?
Oh, yes.
Now, Ms. Brown is making some excellent clinical progress on the Quantum, and what we wanted to do is demonstrate some of that progress for you at a dressing change. In addition, as you're well aware, the utilization of negative pressure wound therapy devices is a technical skill that needs to be developed. Each device is slightly different, and ITI supplies excellent clinical support for the education of our staff. We're also joined by Brenda. Brenda is one of our clinical nurses here, and Brenda does have experience in negative pressure wound therapy. However, this is a new device for you, and Beth has agreed to sort of walk you through this new device. So
Wonderful.
This is the device here. This is the Quantum. Boy, it's very light.
It weighs less than a pound, Dr. Niezgoda.
Very small. How about the functionality compared to other devices?
One of the most exciting things about this device is you actually have increased functionality as you've decreased in size. So it's a powerful device that can be used as an important tool for wound healing.
Well, why don't you do this? Why don't you walk Brenda through the Quantum, and let's do a dressing change, and we'll see some evidence of clinical healing and how this device actually is performing clinically.
Great. You know, one of the things that's best about this device, Brenda, is it's almost intuitive to operate. A couple of features that I'd want to make you aware of. For one thing, it's important that sometimes that you monitor compliance with your patients. And so as you turn this device on, you're going to notice that in the display it flashes D and a number, one digit at a time, and then H. That way you know how many days and hours are remaining on the device. It starts out with 30 days. So you can actually track therapy compliance with your patients. Beyond that, the device is pretty intuitive. I bet you can change the pressures.
And I'm guessing the blue arrows right here. Let's see. Yep, and we just went down to 100. And I can increase it to 150, so it's very easy to move along the different pressure settings. Now, how would I make this intermittent if I didn't want continuous pressure but I wanted intermittent?
We have actually made intermittent very easy. You just press the button that's below the arrow keys, and when the light is lit, you're in the intermittent mode. And one thing that I do want to point out to you, we encourage the use of intermittent, especially in the outpatient setting. And with the intermittent mode, your device is going to be at target pressure for 5 minutes and then down to minus 25 for 2, so that your patients don't lose their dressing when you're using the intermittent mode.
Oh, wonderful, wonderful.
One thing that you'll probably want to do is lock your pressures out so that grandchildren or patients are not able to change pressures at home.
Right.
So to lock your patient's pressure out, you simply press and hold the green on button until you hear a beep, and it'll take about 4 seconds.
And so it's locked now.
You're
and
locked
I cannot move down or up.
And
wonderful.
That's exactly right. It'll also lock in your mode. So if you're set in intermittent, it will remain in intermittent. And then to unlock, obviously, you just reverse the process.
And there we go. I
Right.
can now move along again.
The other thing that you'll want to know how to do is to change the canister, Brenda. And the canister is pretty easy. You simply press the silver button at the top of the device, drop the canister out. That connection's pretty snug. And to replace the canister, you simply line your sensors up and snap the canister into place.
Okay, that
Right.
is easy.
Right. We're really proud of the Quantum. Hey, can we look at your wound and see how you're progressing?
Yes.
Great.
I am very impressed, Beth, with the progress that we have made over a very short period of time.
Well, one question I wanted to ask you is, do you notice less foam in the wound with this device? Because our foam is actually sterilized with ETO rather than irradiated.
It doesn't appear that there's as many fragments. I would agree with you there.
And also, I love your ingenuity with irrigation. I don't know if you even realize, Dr. Niezgoda, but we have a patent on simultaneous irrigation, and you appreciate simultaneous irrigation.
Absolutely.
Did you know that we could set her up with one, just as you put your catheter in?
Right.
I could show you our irrigation Speed Connect. We could set her up to irrigate in the same manner using our Speed Connect.
Why don't we do that? Could we do that on this dressing change?
I have one with me.
So we'll have two ways of doing that. I don't think there's any other negative pressure devices that have that Speed Connect available, and that would be nice to know. That would be a very important feature.
Also, every other negative pressure device, the device has to cycle off when the wound is filled. You'll notice she has no maceration, and it's because you're doing your irrigation simultaneous to negative pressure.
Right, we don't come off the negative pressure at all.
Exactly.
And it comes with everything that you need for the dressing. Comes with the tubing for the suction, the sponge, and then the tape that we use. Then we just cut to size.
For the road, we're going to go ahead and put that sponge in place. Fitting, you did a nice job of cutting there, Brenda. And then slowly walk across the wound, securing the sponge. And very nice, nice seal. That looks beautiful. And we take off this part here. Probably could have done that better, huh? All right, so I'm not an expert yet. All right, that looks good. Brenda, you going to track it? Trackpad?
Yes, I'm going to track it up over to the side, because if I were to put the center track right here with the skin folds, it can bend and just cause problems. We want to make sure that we always have a good suction, so we're going to track it off to the side. And we'll
Do you want to bring it up any
piece of-
higher, or right here is fine? What do you think?
Actually, right there would probably be fine,
Okay.
because we'll want to change places just to
Yeah.
each dressing change. You just want to change sites to help protect the skin.
So I will fashion a piece of sponge for the bridge, if that's okay with you.
That would be wonderful. If we're having the track over here, then we should probably put in the irrigation over on the other side so that the...
Right, I agree with that. So let's go ahead and we'll just create a little fenestration there. You say the size of a nickel?
Yes.
Is that close? Looks sort of like a strange nickel size, but that'll work. That's better. And we'll bring that up. So that'll give us the bridge, right? And then we'll put the
We'll place that off to the side.
got a good seal there, I'm sure. Okay, so now we're going to put in the port for inflow, and you say we can do it right there.
You can do it there, or if you need to bridge it up to
I
avoid
think
getting
if we,
caught in her crease.
What do you think? I
Looks
think
like
we'll be okay.
she'll do okay.
I think
I
we'll be
think for an
okay.
infusion,
Yeah.
that would...
We'll just cut a little. We'll cut it on the high end here. Good. How much tubing would you like? Extra tubing. This is going to be for the infusion, right up there. Got it. So we'll cut that off. And we will put this on here. We'll aim it upward, keep it comfortable for you. All right, let's see if we did a good job, Brenda. See if we have a seal.
Okay, and it's very easy to take the canister out. Silver
Once you-
button.
So it just slides right in there.
Just line your ports up and it clicks in.
And this goes on top here. And Brenda, I'll let you do the honors.
And remember to plug the device in.
Exactly. And then we will turn it on.
Yeah, look at that.
And we want 125. So I will. And as you see it.
Good seal.
And you know you have a good seal because your pressure light is solidly lit. If it was blinking and you heard the device running, you would know there's a leak somewhere. And after about 3 minutes, your leak alarm would sound and the condition would show in the display.
So what do you think?
It was super easy to use. It's all very self-explanatory on the side here, and that was one of the easiest infusions I've ever put in.
Thank you so much for joining us today. Let us share your story. I'll see you next week. And like I said, we're getting to a point where we really don't need negative pressure therapy anymore. The wound is completely granulated. It's very superficial. There's no undermining, no tunneling, and those are all our clinical criteria for stopping this. So we'll switch you to another dressing. I got some good thoughts on that. But you're just about done with this. How does that make you feel?
Excited.
All right, very good. Thank you so much. Hopefully you found the technology fascinating and the instruction helpful to your clinical practice. Brenda, thank you so much for joining us.
Thank you.
Thank you, audience. We'll see you in the next segment.